The topic that I am going to discuss with you today is major depressive disorder. It is also known as clinical depression or simply known as depression. It is a serious mood disorder, and those suffering from it tend to experience feelings of sadness persistently or continuously. They also feel hopeless and lose their interest in everything they once loved. This disorder doesn't just have emotional symptoms but also has physical ones, which we will discuss during the duration of the video. Hopefully, by the end of this video, you'll find yourself to be more knowledgeable on depression and aware of the difficulties that come with it. What we will discuss in this video is the definition of major depressive disorder, its symptoms and diagnostic criteria. We will also look at a brief history of depression. We will see what its causes are and how it can be treated. We will also see the difference between depression and sadness, and then we will discuss some of the misconceptions about depression and why awareness of depression is important. Alright, as I explained before, depression is a mood disorder that, according to the American Psychological Association, is defined as a serious medical illness that negatively affects how you feel, the way you think, and how you act. This definition tells us which aspects of us depression affects. These are the way we feel, the way we think, and the way we behave. The symptoms of depression, as the symptoms of any disease or disorder, can range from mild to severe. In order to make a proper diagnosis based upon these symptoms, the person must be showing or exhibiting at least 5 of the symptoms of depression for a period of 2 weeks, and one of the symptoms must be either a depressed mood or loss of interest. As mentioned before, depression doesn't just have emotional symptoms, it also has physical symptoms. And now we will discuss both the emotional and the physical symptoms of depression. Emotional symptoms include feelings of sadness or feeling depressed. It includes the loss of interest in activities that were once the person's favorite or even normal everyday activities. It includes feelings of worthlessness in a person and feelings of guilt. And it includes increasing thoughts of death. Physical symptoms include change in the person's appetite, which causes them either weight loss or weight gain. The person also has trouble sleeping or may sleep too much. The person feels a loss of energy or they feel increased fatigue or tiredness. There is also an increase in physical activity that does not have a purpose. For example, activities such as fidgeting, not sitting still, pacing, moving around, wringing hands, and this activity is so severe that it is noticed by others. There is also difficulty in thinking or concentrating in the person, and they also become indecisive. Now we will discuss the diagnostic criteria of major depressive disorder as given by DSM-5, the Diagnostic Manual for Psychological Diseases. The criteria is as follows. Number 1. The person suffers from depressed mood nearly every day. Number 2. The person has diminished interest in almost all or all activities nearly every day. Number 3. The person suffers from significant weight loss or weight gain due to decreased or increased appetite. Number 4. The person suffers from slowing down of thoughts and reduction of physical movement, meaning they are not able to think properly or quickly, and they are not able to move as much as they used to and feel restless. And these things are observable by others. Number 5. The person feels fatigued or they feel they have a loss of energy nearly every day despite resting. Number 6. There are feelings of worthlessness and guilt in the person. Number 7. The person has recurrent thoughts of death. Number 8. The person should not have any pre-existing medical conditions such as thyroid problems, vitamin deficiency, anemia, brain tumors, etc. that can also produce symptoms of depression. They should not be on any medication that can produce symptoms of depression, and they should not be addicted to any sort of substance, for example alcohol or drugs that can produce symptoms of depression. A person can only be diagnosed with major depressive disorder if they fit the criteria given for it. All of the symptoms mentioned in the criteria do not have to be present to make the diagnosis. As mentioned before, at least 5 of the symptoms should be present in the person for a duration of 2 weeks. Now I will discuss how depression differs from sadness. People assume that depression and sadness are one and the same, when sadness and depression are two things that are completely different. Sadness is an emotional reaction that everyone has to upsetting situations, and this emotional reaction fades with time. Depression, however, is not an emotional reaction, it is a mental disorder that interferes with a person's daily life and does not fade with time if left untreated. For example, when you find that you lost the chance to go see your favorite singer's concert, you'll feel sad for some time, but it will go away after a while, maybe in a day, maybe in a few hours. But depression is being in a state of constant sadness and not being able to overcome it. Now we come to the history of depression. The credit for its discovery doesn't just go to one person, but it goes to every person who researched on it and made it possible for people to understand it. The earliest written accounts of depression were found to be from Mesopotamia, written in the 2nd millennium. According to this written account, it was thought that depression was a spiritual condition that was caused by demonic possession. People believed that people suffering from depression were possessed, and that this possession was a result of some sort of bad deed that it did, and that they were being punished for it. This belief existed in the cultures of the Greeks, the Romans, the Chinese, and the Egyptians. Different people belonging to these cultures gave their different theories on depression. A Greek physician called Hippocrates stated that depression was caused by an imbalance in 4 body fluids that he called humors. These body fluids were named as yellow bile, black bile, phlegm, and blood. He thought that an increase of black bile caused depression. Another person, a Roman philosopher, believed that depression was caused by rage, fear, and grief. In the Common Era, it was still believed that depression was something adverse, and the treatments continued to be beating, starvation, or confinement. But a Persian doctor believed that depression arose from the brain and recommended treatments such as relaxing baths and rewards for positive behavior, which was a very early form of behavior therapy. In the Middle Ages, people believed that depression was caused by the devil, demons, or witches. Majority of the treatments then were exorcisms, drowning, and burning people. Exorcism is an act of taking out an evil spirit that is possessing a person. In the Age of Enlightenment, people believed that depression was an inherited weakness that could not be treated. And due to these beliefs, the people with depression were either locked up or shunned, meaning they were not accepted by society and were shamed into staying separate from society. In the latter part of this era, it was suggested that depression was caused by aggression or anger by some people. Others suggested that depression resulted from internal conflicts or clashes between what people actually wanted and what they knew was right. Some people also searched for physical causes of depression. From 19th to 20th century, people's thoughts and research on depression began to change. Misconceptions still existed but became closer to what we know of depression today. Now we come to the causes and the treatment of major depressive disorder. We will discuss how depression is caused and how it can be treated. First, we will discuss the causes of depression. Depression can be caused by a number of factors, some of which are as follows. Early childhood or teenage trauma. Traumatic events that have occurred in the early stages of life may lead to depression in children or teenagers, and it might go on with them in their adult years. Low self-esteem. For some people, having a poor self-image or poor thoughts about themselves might cause them to fall into depression. Family history. It has been found that depression can be passed on and inherited by people, so their family history can also be a cause for their depression. Substance abuse. For people addicted to drugs or alcohol, extreme use may cause depression. For people who have trouble adjusting to medical conditions, falling into depression is common, as they are unable to process or adjust to their disease. The injury. People who suffer from bodily harms, such as having lost limbs or being paralyzed, they may also suffer from depression. Prior mental disorders. Pre-existing mental disorders may also cause people to suffer from depression. For example, in post-traumatic stress disorder or anxiety, people can also develop depression. Lack of support. Lack of support from their family and friends may also cause people to suffer from depression. Moving on to the treatments. Due to the recent advancement of researches and studies, depression is a treatable disorder. Around 80 to 90% of the patients of depression become better with treatment. Before treating depression, it is made sure that the depression is not caused by medical condition, medication, or substance abuse. Depression is treated through medication and/or psychotherapy. In medication, antidepressants are used to change brain chemistry of people. That is, they are made to feel happier. These medicines do not have any effect on people who do not suffer from depression, and in case the people who are taking antidepressants do not show any improvement, the psychiatrist either increases the dosage or changes the kind of antidepressant being used. Psychotherapy is a kind of talk therapy in which the patient talks about their problem. In the case that the patient suffers from a mild level of depression, psychotherapy is used to treat the patient. But if the patient suffers from a severe kind of depression, then psychotherapy along with antidepressants are used for their treatment. Lastly, I am going to discuss common misconceptions that people have about major depressive disorder and why awareness of it is important. People believe that depression isn't a real illness, which is not true. Depression is a complex mental health disorder. It has social, psychological, and biological origins, and it can be treated in a variety of ways. I also think that antidepressants can always cure depression. While antidepressants are used to treat depression along with other methods, they are not the cure for depression. People also believe that antidepressants can change their personalities and that you have to take them forever. But that is not true. Antidepressants do not change people's personalities, and you do not have to take antidepressants forever. People think that depressed people can simply stop being depressed whenever they wish. That is not true. Depression is an illness and it takes time to be treated. It's also believed that depression only happens because of a sad situation. That is not true. As we saw from the causes that are mentioned in the video, depression can happen due to a variety of reasons. People think that if someone's parents have depression, they have to have it too. That is not true. While it can be inherited, it is not necessary for the children to have depression. There is also the belief that only women have depression and that talking about it makes it worse. Both of these things are not true. While studies have shown that women are depressed more as compared to men, men can also have depression. And talking about depression does not make it worse. In fact, it makes it better. In order to eradicate these misconceptions that people have about depression, it is important to spread awareness of depression so that people suffering from depression are able to reach out and receive help for it, and that other people are aware of the challenges and difficulties faced by them. In conclusion, depression is a mood disorder that differs from sadness and affects how people think, feel, and behave. It has emotional as well as physical symptoms, at least 5 of which have to be present for 2 weeks for it to be diagnosed. The causes of depression vary from childhood trauma to lack of support. But depression is a treatable disorder and can be treated through psychotherapy and/or medication. The misconceptions about depression can be eradicated by spreading awareness of it. Its awareness is also important in order to allow people to seek help they require for it. Thank you for watching.